We also are here to help the eye care community, especially in this changing dynamic that we see around patients and their beliefs and their expectations as they come into our practices. And I'm proud to say that since 2021, our See Tomorrow campaign has been effective, and we've been doing a lot of research in this area, mostly around consumers and what their beliefs are, our current patients and our prospective patients, their beliefs around contact lenses. But we are excited to share some data from eye care professionals such as yourselves. So this year we decided to partner with the Vision Council, so thanks Alysse for representing here, around being able to broaden our perspective of who we're talking to, but also the work that we're doing. I am joined by our illustrious panel here. We have 3 of our contact lens institute visionaries. So the Visionaries are a select group of individuals across optometrists, opticians, and staff members who have a modern view of how they practice with their contact lenses in their practices. And I'm happy to present Dr. Shelby Brogdon, who has who's practicing in McFarland Eye Care in Little Rock, Arkansas. Also Dr. Alysse Hornick, who's practicing at Stanford Branch Optometry in Rocklin, California. And Dr. Sabrina Gaan, who's got a practice called Eyes on Plainville in Plainville, Massachusetts. And of course, Alysse Henkel is representing from the Vision Council. So Alysse, I'll turn it over to you.
Great, thanks so much. Yeah, we were excited at the Vision Council to partner with the Contact Lens Institute to do this study where we asked folks from our eye care provider panel information about what a positive contact lens culture looks like at their organization. So we had 173 respondents from our panel, which relates to generally about a 6.5% margin of error. We conducted the research online just in August, so this is hot off the presses here, and we're excited to dive into some details.
Great, thank you. And I see Dr. Schaefer back there hiding in the corner. He is another one of our visionaries. And any of our other visionaries here oh, there you are. Thank you so much for being here with us. So I am so excited to give you guys a sneak peek, because as I mentioned, we just collected this data a few weeks ago. The full report will be available in October. But we're here to give you a sneak peek on the data that we collected. So what we did is we took responses from across the eye care industry in different types of practices. And what we found is that there's similarities in how the different roles are valued different aspects of the contact lens culture. This is just a reminder also that creating this positive contact lens culture and being able to nurture it involves engaging the whole practice. So it's not just the doctors who may prescribe it, but it is also those who are in our practice that can support it. So I'm going to turn it over to the panelists. Anything that you can share that you do in your practices to support a positive contact lens culture?
I would say for us, I'm in a large MD-OD practice, and so it is trying to engage everybody, which is a little harder when you have multiple offices and multiple staff, but we come together, all of our ODs in our practice, and regularly talking about contact lenses and kind of where we want to move forward together, and I think that's been really great for us to be kind of cohesive across multiple offices.
Lisa and I we both agree that we talk to every single patient about whether or not they're interested in contact lenses. It's actually quite amazing, like how many people think they are not candidates for contact lenses because they have astigmatism or because they have presbyopia. And if you don't mention contacts as an option to them, they actually have no clue that they are candidates for contacts. So it's really important to just mention and say, are you interested in contact lenses? Did you know that there's a multifocal option? You don't have to wear glasses all the time, or you can be a part-timer.
Yeah, we do the exact same thing. So we actually involve, our front desk
receptionists, we involve our technician, and we involve our opticians in the whole entire process. Because we want that continuity and that positivity to really be shown through the entire patient experience. But we start with our front desk, and we have our receptionist just ask 3 simple questions. And that's, are you wearing contact lenses? If not, are you interested in contact lenses? And then we also ask if you're interested in refractive surgery, and do you have any dry eyes? So that kind of, that light bulb turns on, and the patient said, and you're already starting that conversation. Oh yeah, let's think about contact lenses, and maybe that's an option for me.
You're right. Just keeping it top of mind creates that positive culture. The next opportunity is around walking the talk. So what we found is sometimes the beliefs don't always translate into actions. But the great news is that 94% of the survey participants believe that they have a positive contact lens culture. That's fantastic. Yet, only 84% actually stated that the practice encourages patients to consider contact lenses. And the same percentage encourages doctors and staff to recommend contact lenses. So we've got a 10-point gap in there between what we believe in and actually what we think that we're doing. And even more telling is the next statistic that we have, which is that only 49% discuss contact lenses at every encounter. So this is an opportunity, I would say, for us. And these are for anybody who's eligible to wear contact lenses. So some of our previous research that we've done, that I mentioned, also found this on the consumer side, is that 2/3 of the patients that come in reported that they didn't recall any contact lenses being brought up to them in the last 2 visits that they had in the practice. So on our patient side, we're seeing that translate. Additionally, 44% of glasses wearers said that they're interested in contact lenses, but the option was never raised when they went in to get their exam. So I'm going to ask the panel, do these statistics surprise you at all? Doesn't surprise me, because when my patient comes in and says to me, I bought the ugliest pair of glasses to match my dress for my daughter's wedding, and I'll never wear them again because I didn't know contacts was an option for me. Like, blows my mind. So, it's really important to talk about contact lenses with every single patient, even when you don't think that they're interested.
Yeah, I was gonna say I was a little surprised that it was right at 50%. And I think that is a huge opportunity for growth. If those other 50% who haven't been start doing that, I mean, that's a huge difference for their practice.
Yeah, I mean, these are patients who are in our practices already, so I just see that as all upside. These are just opportunities that we can take advantage of tomorrow. Additionally, so our latest research indicates there's different parts of building a positive contact lens culture. And what we saw was we showed really great options for each of us and how to build that. And it's based on whatever your practice performance is and what your needs are in your individual practices. So when we looked at all the different factors, we looked at 21 different factors, 16 of those factors scored 70% or higher as being important. So I'm going to start with the top, those that scored at the top. Now, not surprisingly, product emerged as this top opportunity or fundamental components. And this dominated, these were all in the 90th percentile, so I don't think any of that surprises us. Now we'll move to the bottom few factors. And these, now none of them scored below 50%, but the bottom grouping did show that in the eye care, at least when we think about contact lenses, they're not necessarily aligned with some of the commercially oriented components that we might see dominate other industries. What I do want to spend some time on is the middle cluster, though. This middle cluster, I think, again, is the biggest opportunity for us to think about and what we have to control in our own contact lens practices.
So all of these were only separated by 8 points, and there might be elements that we can think of dialing up. So things around education, in-practice advocacy, and personal benefits or benefits for our staff. So I'm going to ask the patients. I'm going to ask our panel, do you guys leverage any of these in your own practices?
For sure, I think for us, something that we leverage, something we could also be better at is in-office training. I think, like we were saying, having everyone from the front office to the optical to the technician to the doctor all on the same page and all kind of speaking the same thing to that patient. Even the people, we have a whole different group of people who answer our phones, but even them having some knowledge of contact lenses can make the patient feel more comfortable. Or if they're calling, hey, I'd like to make an appointment, making that point to say, well, are you interested in contact lenses? And, making it something that everyone can be involved in. I know when I was working as a technician, but before I went to optometry school, the education that I got, not being a contact lens wearer, just working in the practice, really empowered me just to talk to patients more in the exam lane when I was working them up about contact lenses. So I think empowering our staff with that education is going to give them the confidence to talk to patients about contact lenses.
I'd like to speak on personal experience. So I always like to bring in my personal stories and my personal experiences with my patients whenever possible. I think that really helps them to understand. And I am a 7 diopter myope. I've been wearing glasses, I've been wearing glasses since I was 8 years old. And when I had the opportunity to start to wear contact lenses when I was 13, I was a teenager, so I was tired of these glasses, I was embarrassed by them. It was really life-changing to me, and it was just such a positive experience. So, I always tell, especially parents, when we're talking about maybe doing some contact lenses for children, they might have a little bit of anxiety or apprehension, are they able to do this? Are they going to be able to clean them and take care of them? And I just let them know, you know what, they are going to love it. It's going to be the most positive experience. This was my personal experience. There's nothing to be afraid of. It's quick, it's easy. And I think that just really helps those parents kind of ease their apprehension.
But that's why it's so important that everyone tries the new products too, because if your staff and your doctors know about the new products out and they rave about them, then it really reflects it. They want you to be excited about the contact lenses and be like, oh, that's new technology. Did you know that this has blue blocking technology in your contact lens? Like, that's huge. So it's having a 7 diopter myope talk about their experience is kind of important.
Yeah, you're right about that. I think also that brings that sense of trust to the patients, and it empowers everybody in the office to be able to talk about it from their own experience. So those are really great points. Okay, so we're going to share one last sneak peek. And in this day and age, I would say, I think we would expect a lot of practices to be measuring their practice data. And one of the things that we assumed was that practices were measuring how well their contact lens performance was, or their contact lens business was in their practice. And so what we actually found was another opportunity, I think, for practices. So what we found was that only 47% of practices were quantifying the business impact of their contact lens patients versus their non-contact lens patients. And so this surprised a number of us, because when we saw this, well, we'll talk about that in a minute, but of those who do assess their business impact, only 56% found that they were more profitable with contact lenses, where 38% thought that they were less profitable with contact lenses. So these, thinking about contact lens practices that are really successful in doing a lot of business in this area, I think this surprised them. And so I'm going to turn it back over to the panel and let me hear your thoughts.
This one actually shocked me because, it's common sense. It's like, okay, if you have a contact lens wearer, they're buying contacts, glasses, sunglasses, but for a lot of doctors, they just assume, oh, they're just going to get their contact lens prescription and walk. It's like, well, why don't you educate them about the fact that they need new glasses, or can you even see in your glasses? Like, have you ever asked your patients, like, how old are your glasses? How many of them say they're 10 years old and I can't see out of them?
Yes, I'm going to piggyback right off on that because the same exact experience happens in my office too. I have this conversation with every single one of my contact lens patients. I say, do you have a pair of glasses? And I am so shocked, again, at how many don't have them, or they're 10 years old, or they say, yeah, but I literally take my contacts out, throw them away, and I go right to bed. And so I just don't need them. And I let them know, well, actually, I would love you to have a pair of glasses because there are going to be situations that you're just not going to be able to wear your contacts for some reason or another. Or maybe in the evening you want to take a break and give your eyes, a couple hours rest from the contact lenses. So it is so important that you have a backup pair of glasses and that it's an updated prescription. And I also let them know, how about prescription sunglasses, just like you said. That's such a great option. I love my prescription
sunglasses.
Or even Plano sunglasses, exactly. So I wonder how they're getting these calculations because, like you said, it just doesn't make sense.
And I would just add, from other consumer research that we've done at the Vision Council, with those who buy contact lenses, we've seen in terms of ODs making the assumption that people are just going to walk with their contact lens prescription. We do see more contact lens purchasers buy online than for glasses, but at the same time, those who buy contact lenses online are citing convenience as their top reason why they're buying online, and the same thing is going for the in-person folks. So I think as long as folks working in a practice can really try to make the contact lens buying experience very convenient for those who are already in their practice. That's I think what we're seeing at 52% of contact lens purchasers online are saying they're doing it for convenience, and only 39% are saying they're doing it for price. So I think there's a lot of ways that practices can better connect with patients to help with that.
Well, literally I tell my patients, I'm like, did you know that we can ship them right to you? So you can literally order them right now. So, and we have better rebates and stuff. They're like, oh, I usually buy online. Let me look into that.
And then as far as all the data, I would just be curious to people who think that their contact lens patients aren't profitable. Are those the people who aren't measuring it, or not measuring the full capacity of their contact lens wear? Because I know it'd be easy just to think, okay, how many contact lens sales and what's our margin? And that's it. But yeah, you have to consider all those other factors like buying sunglasses. And my contact lens patients are the ones that are in my chair every year, on the date because they need more contacts. So it's just thinking about that part of it. Is it the people who are just not even considering all those factors, or the ones that are considering them not profitable? And then, hey, maybe that's the reason why they aren't bringing it up to every patient because they don't believe that they're actually profitable.
And they're complaining.
That's a good point.
Yeah, it's like a circular problem there and an opportunity. So I think you guys all bring up some really great points, especially around patient awareness and things that you guys have that are available in your offices that, again, going back to our first data point about involving the whole staff in this contact lens culture, is that there are different touch points throughout that practice that the patient has with all of those who are involved in the practice, where there are opportunities for that patient to be more satisfied, I'll say, and have that expectation of convenience met that they may not have even known was available in your practice.
Yeah, and I would just add to that, other consumer research that we've done with contact lens purchasers, 53% say that office staff have an influence on their contact lens purchase decision, whereas 65% say that their optometrist has an influence on their contact lens decisions. So you can see how leaving out that conversation is also, leaving out those potential sales too.
Yeah, I think that's a great point, is the importance of involving the whole practice in this. And I think some of us also forget. I mean, maybe we didn't have a Dr. Hornick tell us the story about, being a 7-diopter myope and the benefits that she had, being able to have the option of contact lenses as an opportunity for her. So I think those emotional stories are sometimes great to remind our staff, especially if they don't have a prescription themselves. It's not necessarily top of mind for them. But what I wanted to conclude with is that we hope that through sharing this culture calculation, the data-backed behaviors for contact lens success, spark some conversations in your own office, because again, all I see is opportunities for us to help more patients out there, and also to be able to help our practices at the same time. So the comprehensive report, as I mentioned, will be published in a few weeks. So it'll be available, and you can see that as well as our other previous research on the website, contactlensinstitute.org. So that will be available in just a few weeks. So I do want to thank, firstly, all of our panelists here. Thank you for taking the time. Thank you to the Vision Council and Alysse for representing, to Vision Expo here for hosting us. All of you in the audience, our other visionaries here with us. Thank you all for participating and joining us in this discussion, and we hope it sparks more. Thank you.